Patron can be accessed via Trust applications or via applications on the intranet. Key message: to log into Patron, you will use the same logon details and password as your intranet password. Note: for this training video, we will be using anonymized live data so that we can get a realistic feel for the process. We begin on the home screen for Patron. Here we can see the dashboard section. We will look at this in more detail later in this training. Notice the patient search section. This works in exactly the same way as the AdvantisED patient search. You can use NHS number, district number, or case note number. Here we can see 3 tiles that enable us to navigate to the Advantis systems. There are other digital systems that can be accessed using Patron. These include ePMA MedChart for prescribing medication and viewing the medication chart. Evolve, which allows you to see the electronic case note for a patient. GMCR, Greater Manchester Care Record. However, the patient must have a Manchester GP to use this. Patient Track for recording and viewing observations. Review web results for viewing laboratory results. Sectra Packs for viewing radiology images and reports. We can also see some other specialty systems which are due to follow in Phase 2 of Patron development. Patron Dashboards. Using the Dashboard section is the easiest way to find a patient. Click the Clinics link. The Today's Clinics list is defaulted to show all specialties and consultants. The list will only show clinics for the current date. You are unable to move backwards or forward by date at the moment. Being able to change the date is planned for future stages of Patron development. The list can be filtered down to specific clinics. Click the All Specialties drop-down. Here we can see an abbreviated list of specialties in alphabetical order. For this example, we are going to select GMed, General Medicine. Click to select GMed. Now that we have applied the filter, we can only see GMed clinics. The second filter that we can apply to the Today's Clinics list is Consultant. Click the All Consultants drop-down. Here we can see an alphabetical list of consultant codes, which are usually their initials. Click to select Dr. Kong's code, NGK. Now we can see all GMed patients booked for Dr. Kong for the current date. The list is for the consultant clinician and does not take into account the clinic code used in PAS. The Today's Clinics list is in time order and cannot be rearranged. The patient's name within the list is interactive. Clicking to select the name will allow you to enter the patient's record. We will look at how to view the patient's record in a moment, but first we want to show you how you can also search using the ED dashboard. Click the back button. Click to select ED dashboard. This is a miniature version of the dashboard used in the emergency department, with some minor alterations to help visibility. Alerts and some of the clinical data that is usually visible on the full plasma view is not displayed in Patron. For example, nurse, clinician, news to timestamp, clinical frailty score, clinically ready to proceed, and awaiting CT information. Key message: it is recommended that you use the full AdvantisED application if you are clinically reviewing patients within the emergency department. Patron can be used to select the patient, but full information is within the AdvantisED application itself. Key message: to view the alerts, you will need to click on the View Alerts button. Click the View Alerts button. Here we can see the icons have appeared within the Alerts column. Clicking the Show Key button will provide an explanation of what each alert icon stands for. Alternatively, you can hover over each individual alert icon to discover its meaning. As with the Today's Clinics list, clicking on the patient's name will take you into their record. We are going to look at viewing a patient's record in a moment. However, for now we want to continue to look at different ways in which to find a patient, so we will click to go back. Click the Back button. If you work in an inpatient area, you can use the Ward Dashboard option to find your patients. Click to select Ward Dashboard. Here we can see a list of all wards. You simply click the ward that you want to view. Click to select E2. We are taken to a mini dashboard for E2. Notice the scroll bar at the side. This indicates that there is more information on this page than is currently visible on screen. You would use the scroll bar to move down the screen to view the rest of the information. Key message. Similar to the ED dashboard, not all of the icons are displayed on the list. You need to click the view buttons that run along the top of the screen. From this screen, there is a shortcut to launch ePMA administration. Click to select ePMA administration. Key message. The first time you go into ePMA administration from the ward dashboard, you will need to enter the ward you want to view. After this, it will remember the ward until you close the tab Session. Using the drop-down will allow you to select the ward that you are working in the same way as you would if you were prescribing or administering medication. Clinical Safety Message. Notice here that ePMA has opened in a new tab and Patron is retained as the first tab. You are reminded that when you have finished your review, you need to remove tabs you have opened. This prevents the risk of misinterpreting information. Click to close the MedChart tab. We are returned to the mini dashboard for E2. Patron viewing a patient record. Although we are going to select the patient from the ward list, the process would be the same whether you select the patient from the Today's Clinics list or the ED dashboard. Click to select the patient, Michael Training. This screen is used to review demographic information for the patient. Here we can see any alerts and notices regarding the patient that have been recorded in AdvantisED, Ward or CDS. Clinical Safety Message. Before you begin to work with the patient, you must confirm that you have selected the correct patient. When you click Select this patient, you are confirming that you have checked you are working with the correct patient. Clinical Safety Message. To ensure that you have selected the correct patient, check the patient's name, date of birth and ID number. Click the Select this patient button. We are returned to the Patron home screen. Notice that the patient is now in the banner. This means that you are working with this patient. The current patient can also be seen in the Patient Selected section. The Patron home screen has now changed and relates only to the patient that is selected. This allows you to use Patron to review the patient across a number of our key digital systems. Clinical Safety Message. Clicking on the tiles will open the digital systems with the patient already in focus. You must be absolutely certain you have the correct patient selected in Patron to ensure you are seeing the correct patient in the systems that you open. The core systems appear in the upper section of the bottom half of the screen as a series of buttons that are set within a green panel. As we can see in the bottom section of the screen, if you do not have access to a system or the system is not accessible for the patient that you are working with, the button will be pale green. Patient Centre does not work in Patron currently, but is scheduled to be added in the near future. Now that we have a patient selected, let's take a look at the Your Patients List function in the Dashboards section. Click to select Your Patients. Here we can see the Patient Lists option. We can see that we currently have the previous patients list selected. The previous patients list is automatically generated and contains the last 20 patients that you have looked at. However, you can also create your own list using the Edit Lists button. These lists are personal to your login and cannot be shared between users. To add a patient to a list, you need to have created a personal list first. Click to select the pre-created My Active Follow-ups list. To add a patient, we need to click the Add Patient button. Click the Add Patient button. There is an option to search for a patient if you don't already have one selected. However, As in our case, we already have a patient selected in the patient banner, so we will click to select Add Current Patient. Click the Add Current Patient button. We can see that the patient has now been added to the My Active Follow-ups list. The patient's name within the list is interactive, so we can return back to the list at any time and easily enter the patient's record. Click the Back button to return to the home screen. Notice that we are still in the patient's record as their name is in the patient banner. Remember, you must check as you move between systems that you have the correct patient selected. Now let's look at how to review patients using Patron. Clicking the title bar on a tile will open more information. Click the AdvantisED Current Inpatient title bar. This will launch AdvantisED with a patient already selected. Click the Patron tab to return to the home screen. Clicking on the AdvantisEDS title bar will take us into AdvantisEDS, where we can view the patient's documents. Click the AdvantisEDS title bar. Notice that the patient has remained selected. Here we can access the documents by clicking the Work with Patient link. Click the Patron tab to return to the home screen. Here we can see document icons. If we click on the document icon on the AdvantisED Current Inpatient tile, you will only see the HCR's discharge letters are called hospital care records at this trust for the patient. Click the AdvantisED Current Inpatient document icon. Here you would simply click on the corresponding date to view the document. Click the Back button to return to the home screen. If we were to click on the document icon in the CDS document tile, we would get a full list of documents including all the outpatient letters, inpatient HCRs and ED attendance documents. Patron, launching digital systems. Now that we have had a look at the information within Patron, we will look at launching other digital systems via Patron. This facilitates an easy review of the patient across multiple systems. Let's begin with ePMA MedChart. Click to select ePMA MedChart. When ePMA opens, you are taken directly into the patient summary screen. Here we can see the patient's name in both the patient banner and patient summary. You are reminded that you must check that you are working with the correct patient. We can also see the user details here. From here, it is just one click to access medications. Click the Medications ellipses button. We can see that you can also access the administration screen using this method too. Click the Patron tab to return to the home screen. Evolve also works in the same way. Click to select Evolve. We can see that we have been logged into Evolve using our username credentials. We can also see that the patient has remained in focus. You must always check that you have the right patient selected. Click the Patron tab to return to the home screen. Next, we will look at Patient Track. Click to select Patient Track. Patient Track logs you into the patient record using your login details. Notice that the patient selection has been brought forward from Patron. You must always check that you have the correct patient selected. From here, you can easily access the patient's observation charts and assessments by clicking the appropriate tile. Click the Patron tab to return to the home screen. Review web results work slightly differently. Click to select Review web results. When you enter Review web results, Patron launches the application with you logged in, but you will have to search again for the patient. Click the Patron tab to return to the home screen. Finally, we will look at Sectra Packs. Click to select Sectra Packs. The patient has remained in focus, but it is important to check that you have the correct patient selected. All images for the patient are easily viewable by clicking on the image report title on the left side of the screen. Click the Patron tab to return to the home screen. Once you have finished using a system, it is advisable to close the tab to avoid the risk of having multiple patients open simultaneously. However, for training, we have left the tabs open so that you can gain a sense of how Patron works. Clinical safety message. You are reminded that when you have finished your review, you need to remove tabs that you have opened. This prevents the risk of misinterpreting information. We will now click to close all of the remaining open tabs in Patron. Click to close the tab for Advantis Ward. Click to close the tab for Patient Summary. Click to close the tab for MedChart. Click to close the tab for Evolve Patient Documents. Click to close the tab for Patient Track. Click to close the tab for EMIS Health Review, Web Results. Click to close the tab for Sectra UniView. We will now remove the patient from the banner by clicking the cross at the far right-hand side. Clinical safety message. It is very important that you remember to remove the patient from the patient banner when you have finished working with them. Failure to do this could mean that you mistakenly review the incorrect patient's information. Click the cross to remove the patient from the banner. We have now reached the end of this training video.